The National Drowning Report for 2024 has been released, revealing there's been an increase in older people drowning. 92 adults aged 65 or older died by drowning in the last year. There's also been an increase in drownings among people born overseas and people from disadvantaged and regional areas. For more on the report, Justin Scarr, Chief Operating Officer at the Royal Life Saving Society Australia, joins me now. Hi there, Justin. Thanks for your time.
Thank you.
Generally speaking, 323 deaths last year. That's up 14% on the year before. The numbers really aren't going in the right direction, are they?
No, it's been a tragic year, 15% increase. If you remember, summer was quite long and it was quite hot, which meant that there were just many more people enjoying the water, which had some really tragic consequences on rivers and also at beaches.
We have got an amazing array of water areas that people can go to swim, to let off some steam. Where are people drowning?
Look, around 25% occurred at beaches, and that was an increase on the previous year. About 25% also occurred on rivers. And so collectively, these are major locations for drowning. We saw a slight increase in drowning in swimming pools. And of course, dams and lakes and pretty much anywhere there's water and people recreating, we've started to see some drowning incidents.
You mentioned beaches there, Justin. They saw a significant increase in the drownings. Is that solely happening thanks to, rips, unpredictable tides or freak waves? How are people dying on the beaches?
Yeah, look, our colleagues at Surf Life Saving have done some really great analysis, and certainly rips are the number one factor in coastal related drowning deaths, and it is true that as many of in cases people are choosing or perhaps finding their way to beaches that are unpatrolled, away from lifeguards and lifeguard services. We also think that potentially there are many people that are not confident swimmers, and in many cases they can't swim, but they're happy enough to stand in water, and that's when currents, whether it's at a beach or a river, can have a pretty significant impact. So one of the key messages for a drowning report like this coming into summer is that people really need to understand their swimming ability. And if they're not good swimmers or strong swimmers, or in fact, if they don't even swim, then perhaps they need to go to their local aquatic centre, like the one I'm here in Liverpool in Western Sydney, and brush up on their skills ahead of summer. There's adults who learn to swim lessons, which are a really great idea. And if you're not a strong swimmer, or if you're not even a good swimmer, perhaps stay away from those unpatrolled locations. Go to your local pool, or definitely between the flags.
As I mentioned in the introduction there, those aged over 65 years old represent 28% of the deaths. How does that compare historically?
Yeah, this has been slowly increasing, and essentially it's the baby boomers population bubble that's been flowing through the age groups. But those baby boomers now, with all due respect, are starting to get a little bit older, and perhaps they're used to swimming or boating, and they're not aware of the impact of other medical conditions. So if you have a medical condition that causes you to faint, if you're at home or at a shopping centre, then you might injure yourself, graze yourself, maybe even break a bone. But if you do that on a jetty, if you do that near the backyard pool or on a boat, it can really have sort of significant consequences for drowning. And we also see a number of men, particularly older men, swimming, enjoying themselves, but getting themselves into trouble because of some other sort of medical conditions in the water.
Tell me, Justin, what the report found with respect to the migrant community.
Yeah, look, this is really, really tragic when you think about it. About 25% of drownings across last summer were migrants born overseas. About 36% of our long-term data, and that doesn't include the children of migrants. So we've kind of got a significant obligation, particularly for refugees and new migrants. So our data shows that the first months and years are really, really critical. And of course, many people are coming from India, China, Nepal, and these are places that don't historically have a significant sort of cultural tie to learn to swim and swimming skills. And when they come to Australia and explore our wonderful waterways, unfortunately, they get themselves into trouble very, very quickly. The community groups, particularly across the Indian diaspora and the Nepalese, have done a really great job of warning their community members and embracing learn to swim and water safety. So we expect this to slowly change, but we're talking to government about actually how do we accelerate this? How do we ensure that refugees, whether they're settled in our cities or in our regional areas, are fast-tracked towards water safety skills, so that not just that they can prevent drowning, but also they can maximise the wonderful opportunities of our pools, our rivers, our beaches. It really is an important part of of the Australian way of life, and it builds community cohesion.
Yeah, absolutely. You mentioned a couple of things there about prevention. If you're a weak swimmer, head on down and maybe to the local pool and maybe get some tips or some lessons, and then education in the migrant community. Clearly there is investment there that you suggest needs to happen around water safety. What do you suggest? Where does drowning prevention start?
Yeah, certainly it starts at the home, it starts at schools, and it also starts in local pools. We'd like to see a local swimming pool within 10 kilometres or 10 minutes drive of anyone across Australia. It's particularly difficult for people living in outer metropolitan areas and regional areas to access a good local swimming pool for swimming lessons. We'd like to see a more structured program in place, particularly targeting children between the ages of 10 and 12. Lots of those children missed out on lessons as a consequence of the pandemic. Our lowest rates of drowning are actually 10-year-olds, but increases tenfold by the time a person turns 20. And so we've really got to build layers of drowning prevention resilience, build skills on top of floating, swimming, being aware of different water locations, being aware of basic rescue techniques. And then if we can do that through those younger years, then people can have a lifelong sort of enjoyment of the water. You know, there are many jobs in aquatic facilities like this one, and it's really important we work local.
And swim between the flags. That's what I'm constantly telling kids, friends, family.
Absolutely, but it's really important we do our job really well so that we're delivering people to those flag locations that can swim and swim really well, and that makes it much easier for lifeguards and lifesavers on our beaches. Who today they reported they did about 10,000 rescues across last summer.
Wow.
And without those really important services, certainly there would have been many more tragic drownings. So the message is absolutely swim between the flags. But if you're not at all a swimmer, go to your local pool and brush up on your lessons. There's some really great programs in place, and there are lifeguards here as well.
And what's that slogan with RIPS? Is it green is mean, white is right?
Yeah, there's lots of work on how to identify a RIP, how to spot a RIP. I would say to people, if you're in the situation where you have to think about where the RIP is, you need to work all the way up to the other end of the beach between the flags, because the lifeguards are there to tell you where the safe place is to swim and where to look out for it. Because even for surfers or experienced people on the coastal location, it can be difficult to spot a RIP.
Indeed.
And that's why we sort of emphasise if you're unable to swim, even standing in the water, jumping waves is really not something you should do away from that flagged environment.
Justin, always great speaking with you. Thank you very much for your time.
Thanks very much.